A lot of sunshine, blue skies, marine clouds. Just the perfect day to go outside and relax. That's your forecast. We'll be right back.
Yeah, sunny days, sunny days, sunny days. No clouds in the sky.
I'd just like to share a few thoughts regarding this video that you've just watched. If you've made it this far, it's perhaps because you are considering a knee replacement, a total knee replacement, or maybe you've had one, or you're in recovery, or it's something that you're currently talking with your medical team about. I'm not a medical doctor, so I can't offer any direction regarding that, but I can share my experience. Through this video, I did insert moments specifically from the first week of recovery post-op. Now, my plan was to do a full, let's say, feature, to go week by week. But to be honest with you, the recovery is so intense, at least the recovery that my doctor has us do, that recovery was what I was doing. So I took a few short videos as I could, and I figured I would spin them into something else. So that was what you saw today. Now, as I'm sharing a little bit here, I'm going to try to insert some pictures either to the right or to the left of me. I don't know yet. We'll see when we get there. But really, I want to show you the quality of life. For transparency's sake, when I was originally diagnosed with osteoarthritis, I was 49 years old, and now I'm 50. So needless to say, I went downhill rather quickly, no pun intended here, but I did deteriorate rather rapidly. My issues regarding my knees, I started to notice in the summer of 2023, specifically in July. When I was descending up Adirondack High Peak, I noticed that my knees were a little stiff. I wasn't able to climb over some of the what we call scrambles and rock scrambles and slides the way that I had been for years. I was noticing there was not just stiffness, but a bit of rigidity in the joints. And then as the day wore on, I began to notice the swelling. And with some ice and some Advil after the hike, I was able to knock back the symptoms. Another hike in August of 2023, when I was descending the nearly 2,000 feet over 2 miles, I've described it in this way. It looked like there were melons where my knees were. I was wearing compression sleeves on both knees, and they were just so inflamed, so swollen, and it was very difficult to actually get into the vehicle. And then by the time I got home, it was difficult to walk. So I went to an orthopedic surgeon at the direction of my brother, who's also a medical doctor, and I began working with his team. They began to treat me very conservatively. And so over the next 10 months, we tried various injections, and obviously there was lifestyle changes I was trying to make. And at about May, I had had enough. The injections would work for a little bit, and then it would seem to be more intense. So I was having a great deal of difficulty sleeping. Some nights I just wouldn't sleep at all. I consider myself a relatively tough or strong guy, and to be sobbing in bed because the pain in your knee is so tremendous is really, it was a difficult place to be. So at my next visit, the visit where we were going to begin seriously, looking at it more seriously, having surgery, I just told the PA that I wanted to go ahead and begin scheduling this. And of course, there's a lot of work that you do pre-op. So you have to get yourself ready. You have to get your environment ready. You have to, and I think most surgeons have a period of time after your last injection or major medical procedure or dental procedure. My window in that case was 3 months. And by this time I was walking with a cane. So basically May through the beginning of September, I was walking with a cane, as you saw during this video. And it was very difficult. It was very, obviously I was putting a lot of pressure on my right knee, which isn't in the best shape either, but it's far better than the left knee was. And so eventually the surgery day came, and I have to tell you, I know there's a lot of, this was the first time I've ever had surgery. This is the first time I've ever had anesthesia. I've never had stitches. I've never had a broken bone. So I was a little bit nervous, but growing up in a medical family, particularly with a stepfather who was an anesthesiologist, I knew that I was in good hands, and several of them actually had been trained by my stepfather. So surgery went well. I slept through it all. I was probably conscious in the OR for 3 minutes, and then I woke up, and that began the recovery. Now, my doctor, Dr. Andrew Wickline, who is at Genesee Orthopedics and Hand Surgery in New Hartford, New York, has a very unique program. And you start working that joint after you get home from surgery. You only go to physical therapy once, and it's about 3.5 weeks after surgery. And that was when my first appointment was. And by that time, daily, you have worked that joint and iced that joint for about 15 hours. So you ice, as his protocol, you ice for 40 minutes, and then you do a series of flex and stretch of the joint that you saw in this video for about 10 minutes. And you have, as he says, about 10 minutes off every hour. And for the first 2 weeks, that is all you're doing until your first post-op appointment at 2 weeks. He finds that this dramatically reduces the chance of infection. And at that 2 week mark, they evaluate where you are and decide whether or not you need to go to physical therapy or you're doing well on your own. In my case, from what they told me, I was doing very well. I had exceeded, you extend the knee in order to straighten the knee, and of course, you're trying to bend it back. So I was already exceeding the 120 mark, 120 degree mark at my 2 week appointment. And that's his program. And even after that, you continue to ice as needed. You continue to do the exercises. Even at 6+ weeks now, I'm still taking time every day to do those flexing exercises to keep this joint flexing correctly, to help it heal correctly, and so on. Now, I don't know all the science and theory behind it, but all I can tell you is that it has worked tremendously. I have been able to get back to life, and I would say, while I'm still aware that I have had surgery, the joint feels absolutely natural. It doesn't feel like you have something clunky in your leg. You really, unless you stop to think about it as you're walking, you really don't even notice that there's anything different than your joint, except there's no pain. Now when I have pain, I say that it is constructive pain, not destructive pain. But to speak to the pain, because I know that is something that a lot of people wrestle with, over the course of my recovery, you have a journal that you keep that they want you to keep. Obviously, you're keeping track of your medications. You are keeping track of when you've done your exercises and so on. You also keep track of your pain. What is your pain score for that hour? The highest pain score I ever had was 5. So, that wasn't even bad. It was something that you noticed. Maybe you breathed a little bit through, but it passed. Most of the time, my pain was a 2 or 3. During my recovery, I took 2 tramadol. Otherwise, it was Tylenol and gabapentin. Obviously, I can't give you how much that was, but that was what managed the pain. So because the pain was well managed without opioids, I was able to focus on the recovery, on the process, on my diet, on my exercising of my knee, and so on. And each day, especially in the second week, each day you noticed almost 100% improvement on the day before. So that was what I was aware of. That was what I was experiencing. And for me, going through this, even though I know the work that was put into it through those weeks, I wouldn't hesitate to have my right one done when the time is at hand. So just to give you a little bit of a window, that video that you've just watched was 6 minutes, or excuse me, 6 weeks and 2 days after, and it wasn't a big mountain. That was what my physical therapist, she gave me the specs of what I could do, and that was the one I chose to do that with. And it was a marvelous day. it was just such a wonderful day to be able to climb a mountain and experience something that I'm passionate about and something I love dearly, backpacking and hiking. So to be back on the trail without pain, not having, for me, any experience of, maybe uneasiness or imbalance or anything like that, feeling strong, feeling secure, and moving forward. So I just wanted to share a few of those thoughts and hope that it gives you some encouragement, either if you're in the process of getting your knee replaced, or maybe you've gone through it and right now you're having to work it really hard. I can tell you that there is light at the end of that tunnel. So keep on pressing in, keep on flexing, keep on moving that joint, and you'll be back in life the way that you had hoped. So thanks for watching this. I hope this was an encouragement to you. We'll talk to you soon. Bye-bye.